Thank you, and I'm very appreciative that all of you are here to hear the comments that I have to make today. I don't know how many of you have been here since Sunday, but I have, and it's been very, very interesting to me. So I jotted down some buzzwords. Matter of fact, I have 2 pages of them, but I'm not going to read the 2 pages of them. But I heard things such as family-centered, community-based obesity interventions, parents as partners, community and workplace interventions are messy, and messy was mentioned more than once, voice, increased participation, ownership of the program, the joy of being in a small town, networking, connecting with the culture, leadership commitment, collaborative, peer-to-peer, middle managers as gatekeepers, the new generation, passion, denying our biology, the person environmental transaction, and place matters. Well, I'm not a researcher, nor am I an academic. I'm, as Pat Thomas said, kind of an anomaly at this symposium because I am outreach and extension. And I think although the focus of this symposium is on the academic side of the SEC, we cannot neglect our commitment nor our responsibility to the people in our states. And so I want to share with you, I'm going to be talking about university corporate partnerships as well as community partnerships, but I also want to frame that discussion with you because this isn't a research project. It's a paradigm shift in how we look at the way that we conduct business with our partners in the state. I guess I need to, there we go. And so this is about Walk Georgia Partnership, but it's more about our land-grant mission. And 10 of the SEC universities are land-grant universities, and the other states have land-grant universities too. Now, in the southern states, we have 2 land-grant universities, and our 1890 universities are not members of this SEC partnership. But however, they are our partners, and we need to think of who are the other partners within our states that we should be working with if we're really going to move the needle on obesity. Now, you know, we're celebrating our 100th year in Cooperative Extension, and we've had several participants here and researchers who have extension appointments who've talked about their work. But, you know, I've been in extension. I started my career as an extension agent. I worked the majority of my career in the poorest part of the nation in eastern Kentucky. I'm a native Kentuckian, and I am a community member. I've been a community advocate all my life, and a lot of that stemmed from the work that I did with extension. And you'll notice that Cooperative Extension is a partnership of the federal, state, and local governments, but it's also partners with schools, with businesses, with community organizations, and community members, and that's an important distinction. One of the things that our land-grant universities are known for, as well as our Cooperative Extension service, is really changing this country. You know, our roots are in agriculture, but we dramatically changed the face of agriculture in a very short time, and a lot of it is because of the network that we have. Now, why are we not doing that with our health issues and our obesity epidemic? On our campuses, Cooperative Extension is seen as a separate and very different part of the university. And it is not a different part of the university. It is a part of our universities. And we need to be thinking more broadly about the culture that we have at our universities and how we partner within our existing universities. At the University of Kentucky, I directed a health education program that was a partnership of the Academic Health Campus and the Cooperative Extension Service. One of the things that amazed me is at the university, we couldn't even have agreement on what our recommendations were. The College of Medicine had different recommendations than the College of Public Health, and those of us who were trying to do outreach work were caught in the middle of that. And I think there are certain things that we really need to think very hard about as we look at how we partner at our universities, or what messages are we sending the public about what we do. Trying to get people to common ground is a real issue. And we have spent millions of dollars on research in this country, and we're sicker than we ever have been. Why is that? As I listened to the research presentations, one of the things that I noticed is there's no dissemination model. And that's what cooperative extension is a dissemination model. But before I go into our dissemination model, I want to talk about the evolving healthcare system. And this comes from the UCLA Fielding School of Public Health. And I like to think, I'm a very visual person, as most of the people in a lot of our communities are. And so the first era of our healthcare system was really focused on interventions to prevent infectious diseases, and that was is known as the industrial model. Then Health 2.0 is where we're at today, but really we're transcending into another model that's known as the corporate model, and it's really focused on chronic disease management and prevention, and a lot of what we've talked about here at this conference is that. Then Health 3.0, which is tomorrow, but I think it's today because some of the things that we've talked about today at this conference or symposium really is focused on a network model, producing optimal health for all, and a culture of health. That was another word that I wrote down. So how do we create a culture of health? Well, at the University of Georgia, which is now my university, I am really pleased at what we're doing at the University of Georgia, and it's one of the things that attracted me. And I know a lot of people in Kentucky ask, well, why did they were shocked that I would move from Kentucky to the University of Georgia. And the people in Eastern Kentucky were shocked that I would move from Eastern Kentucky to campus. And the reason why is as I was working with policymakers and decision makers in the local communities, I had one decision maker tell me, if you could just get the University of Kentucky to send a team of people to work with us, we could solve some of these difficult problems. The further you get away from our universities, the more difficult it is for people to access the expertise that resides at our universities. This is critical. If you've never worked in a poor county, in a rural county, with people, there are such limited resources, and accessing the expertise that resides at our universities is critical to changing this. So our UGA Obesity Initiative, I was so excited when I got to UGA because it's very difficult to break down the silos on university campuses. Extremely difficult. The larger the university, I think the more difficult it is. But we know the socio-ecological model that you have to have these integrated interventions. We know at the community level we have policymakers, elected officials, the media, government agencies, corporations that exist sometimes, or businesses at that local level. And we have to find the resources located in the different units at our university that we can use to address that. And I'm not going to go all through this because at each university there's different entities, different colleges that need to be at the table working alongside with our communities to make this change happen. And so at each level, we have identified partners in our Obesity Initiative that can help us work alongside the community to get this energy balance. Now, energy balance is something that years ago we taught when we were teaching the Basic 4 food group. You know, at the community level, we gotta keep it simple, stupid. That's our motto, keep it simple, stupid. So, you know, a lot of this stuff way up here, people wanna know, what does it mean for me? How am I going to change my condition? So that leads me to what I want to really talk about is university corporate community partnerships. One of the things, if you work at a local level, particularly when there's limited resources, you have to utilize everyone in the community. And so it's important that, you know, we look at who has resources, who has expertise that can come to bear on the issue that we're dealing with. So we know that there have been substantial resources in the science of obesity that have not been integrated with other fields of practice to impact the community practice to lower the rates of childhood obesity and adult obesity. We know that a team approach to solving obesity is widely accepted, but it's difficult to implement for many reasons, including funding, parochial attitudes, conflicts in the organizational and community missions, values, and goals. So university and corporate partnerships have traditionally been one-sided. A corporation gives a university money and they go out and do good work with it. But in our approach, the relationship is much more balanced in our approach to these partnerships because it's no longer about corporations giving us money to do good work. It's using their knowledge and their expertise that they bring to the issue that is so different than what we have access to on our university campuses. So we can come together to tackle the big issues. And Walk Georgia is an example of that. We did apply to the Coca-Cola Foundation for a grant to support our Walk Georgia program. You heard about Walk Across Texas. Practically every land grant in the university has a physical activity program. But we have limited resources, and we also have limited knowledge of things that we could do that can improve it. And so, you know, bringing the resources of the University of Georgia through our obesity partnership with the expertise with Coca-Cola, we have been able to move our intervention, as we call them, public health intervention. We don't like to call them interventions and extension, but our program forward. Also, we partner with other state entities such Georgia Shape, and this is one of the things that Coca-Cola, they have helped support Georgia Shape, and we're working really closely together so that we're complementing what's going on with the different programs in the state. County governments are a very important piece of the puzzle of helping to get people in their communities engaged in fitness and physical activity and health. Schools, we partner with schools. You see some community groups there. It's very much community driven. The problem resides in the community and the problem will be solved in the community. And so one of the things, and this is a shameless plug for an outreach conference that the University of Georgia is the host of in May for a national outreach conference. And if any of you are interested, I have flyers with me we definitely want to integrate research into what we're doing to inform our practice in the states in which we work. I think one of the things that people don't realize about Extension is we do have this broad reach across all states and even internationally. There are countries who want to mimic what we do in Cooperative Extension to change their communities and the things that are happening there because we have this strong history of being able to make a difference. You know, I talked about disseminating the research. Everett Rogers, Diffusion of Innovations, and I'm not going to ask how many of you have read his book, but he talks about scurvy and that more than 200 years before we actually started solving the problem of scurvy, there was a sea captain who did his own little research project with 4 ships. One ship, he gave all the men 3 teaspoons of lemon juice every day. The other 3 ships, he did not give them any lemon juice. And so what happened is the ship that got the lemon juice, none of the men died of scurvy. On the other 3 ships, he lost almost half of his crew because they had not received the treatment. Okay, he knew that citrus was the answer to solving scurvy. But did his superiors listen to him? No. 150 years later, then a physician who knew about what this sea captain had done did another experiment. But it wasn't until 70 years later that the British Navy actually adopted a change in policy to prevent scurvy and death. So diffusion of innovation and dissemination of research is extremely important to making a difference in this obesity initiative. I would hope that the SEC would take this a step further. Let's connect. Let's change the culture. Let's bring in more partners with us who have different expertise than we do. And let's make a difference in what we're doing out in our states. You know, I'm one of these people. I have 2 season tickets for football games, a season ticket for the University of Kentucky and a season ticket for the University of Georgia. Believe me, I understand the power of the SEC. In both states, on any given game day, you have a captive audience of couch potatoes who are open to any type of intervention, any media messages that can be delivered. So let's use all of our partners to really make a difference. I want to say one more thing, then I'll take a question. Is that, you know, I also heard poisons, food poisons, and Pat Thomas mentioned poverty as being one of those poisons. I think we have to be very careful about what we call poisons, and I'm going to point to the instance of eggs. You know, eggs were villainized for a lot of years as being one of the problems of high cholesterol. And now we've changed our tune. Okay, what messages were we sending to poor people about eggs when eggs were a vital source of proteins and vitamins and minerals? And they're still highly affordable. So, you know, we have to be careful of the messages we send because the public is not very accepting of research. And I heard it mentioned that the university wasn't credible. Well, we need to think about that, and we need to really look at the real root of our problem of obesity. I've used almost all my time. I appreciate you listening. I don't know, maybe I've got 24 seconds, so is there a question? Hopefully you all will come to the breakout sessions so we can talk more about some of these issues. Okay. Thank you.